And here's my audience. My name is Caitlin Grunwald, and this speech is for online CTA 103. Imagine you're at school and you get a phone call saying that somebody you love and care about has been in an accident and that there are no doctors available to help them in that moment. How would that make you feel? I'll give you a second to think about it. Personally, that would make me feel absolutely awful and terrible, and honestly a bit confused as to why nobody was responding to an accident that occurred. There are a lot of people in the world, as well as the United States of America, that feel this way right now. Many people in the lower and even middle class do not have any sort of medical care due to their economic issues and not being able to afford it. By implementing universal health care, it would improve the health of the public, reduce economic suffering, but also strengthen financial stability as a whole for each individual American citizen. So, starting us off, it's important to know that we need to improve the health of the public. A quote from NIH.gov states, countries and territories with publicly funded healthcare and significantly higher mean life expectancy compared to countries and territories without publicly funded healthcare. This is saying that by using publicly funded healthcare, there is a longer life expectancy for everybody who has the healthcare itself, which improves the basic public health. I polled 20 people, and of those 20 people, at least 11 of them have said that there has been a time where they believe that they should have gone to the doctor and have not because they have not been able to afford it. So by implementing universal healthcare, it's giving access to healthcare for everybody, regardless of economic status. Another quote that I found says, universal access to healthcare and coverage imply that all people and communities have access without any kind of discrimination to comprehensive, appropriate, and timely quality health services. So by making healthcare for all, it improves how the public uses healthcare, as well as the ability to make sure that there is no kind of discrimination within the classes, lower, upper, middle class. There is no discrimination between those on who can get healthcare. Now, transitioning into how universal healthcare can help our economic crisis. From World Bank comes a quote that says, viewing health as an investment rather than an expense can unlock human capital and economic dividends for countries. So what this is saying is by viewing health as more of an investment rather than an expense, it can improve our economy. A study that I did showed that about 62% of people believe that by using universal health care, it can help our economy start to boom. What this means is saying that by getting universal health care, it would eliminate insurance premiums. Their out-of-pocket expenses, healthcare costs, I should say, would start to decline, as well as other money that we have in healthcare would start to free up and can be used for other sectors involved. Another quote from harvard.edu says, first, healthier people are more economically productive. Better health also leads to an increase in savings rates because healthier people expect to live longer and are naturally more concerned with their future financial needs. So by allowing people to be healthier and not have to worry about going to the doctor, they are more productive, thus making our economy grow and boom with each individual person that comes into the workforce. Imagine not having to choose between going to work and going to the doctor when you really need to and are really, really sick. Finally, our last point is strengthening financial stability in the United States. So by making sure that people are able to attend the doctor's offices more often and by giving them universal health care, they are more than able to be a bit more financially stable. About half of the adults that I polled say that they are weighed down when they have to try and make sure that they can either go to work or go to the doctor. They are worried about not being able to afford going to the doctor because they are taking time off of work in order to do this. By implementing universal health care, that would completely eliminate every single thing that they would have to worry about, especially cost. I have a slideshow right here. So it's universal health care. So this is basically showing us how universal health care would work. So for a single payer, free government provided health care, which would be paid for by income tax revenue. So it would be income tax that we as United States citizens already pay into. It would just be funded into healthcare. Mandatory insurance. So this is government-run insurances that are financed by payroll and employees. Run by employers and also paid into by employees. It could be privately funded as well. And then our third option, which is national health insurance. So national health insurance would be every citizen would pay into a plan provided by a single insurance company. So every American citizen would be paying into the same insurance company and be able to use that whenever they needed to. Our next stat is how health spending as a percent of the economy. So this is showing us the stability of the economy. So in places such as Canada, Germany, and France, which is like 11.2 to 11.6% of their economic spending as a percent is their healthcare, the United States is a whopping 17.7% of what we spend in our economy is healthcare. So by taking that 17.7%, we could turn that into more economy and more money coming into our economy if we had universal healthcare. This percentage would make our economy boost by a lot of money, and people would use their health insurance more. Healthcare is a human right. Healthcare is a basic human right, and every single American citizen, as well as those who come to our country, need to be able to get health insurance without having to worry about the cost and what it could do to them financially. So using all of these ideas, we can hopefully make sure that universal healthcare would become a realistic idea because it would improve the health of the public. It would reduce economic suffering, and it would also strengthen financial stability in the United States, as well as helping our economy to boom. These reasons and these reasons alone should show that healthcare is a basic human right and should be something that every single person in the United States of America has the ability to get and receive and use as willingly as they need to. I know there are still some of you out there who think that universal healthcare might not be a great idea, and I'm sure that there are some cons. A con that I did find would be that we would have to have longer doctor visits and wait longer to visit doctors, as seen by a study done in Canada. And this is true. Most people wait about 3 months to see their primary doctor in Canada, and that could be for a simple issue. I think the United States could use a different approach and make sure that each person goes to see their doctor every 6 months and annually as well. Just making sure that everybody's healthy and basically triaging how a person is feeling. If somebody is, having a heart attack, obviously they're the first one taken in. If somebody is sick with the flu, they are also taken in before somebody that's stubbed their toe. By using all of these ideas, like I said, we can hopefully make sure that universal healthcare will become a realistic idea in the next few years, as well as the ability to make sure that we as American citizens are granted every basic human right that we are supposedly guaranteed from our president. Thank you.